Welcome. Thank you for joining us today for CEID and Hariri Institute's event, Building Resilience, the Transformative Role of AI in Global Public Health Communication. We are thrilled to welcome UN Undersecretary General Melissa Fleming to share her insights on the challenges posed by AI in the broader information environment, including public health. My name is Tracy Hong. I am a professor at the College of Communication, and I have the distinct honor of opening today's event. Just a quick overview. Together with Veronica Wirtz, I co-lead CEID's Research Core on Trust and Public Health Communication, which is one of CEID's 4 research cores. We are led by Dr. Nahid Badilia, who is the founding director of CEID, which is short for Center for Emerging Infectious Disease. CEID aims to improve the societal resilience against the threat of emerging and epidemic infectious diseases worldwide through public health and policy research, capacity strengthening, training, and advocacy. I'd like to also thank Anna Bakanova and Cassandra Kosek for all that they've done this year to make this event today happen. Just a couple of logistics before we turn to the main event for today. We have invited our featured speaker, Undersecretary General Melissa Fleming, to give a 35-minute presentation, which will be followed by a 10-minute Q&A. We ask those who have questions to hold them to the end. We'll pass around a microphone, and everyone should have the chance to ask the question they want. Today's talk is being recorded and will be later available on CEID's YouTube website. Lastly, following today's program, we invite you to stay for a networking lunch. Food is provided outside. Without further ado, I'd like to introduce you to Dr. Gloria Waters, Vice President and Associate Provost for Research, who is responsible for representing the university to key stakeholders in government, industry, and foundations. She also develops and implements policies and procedures to streamline and manage research. Dr. Waters.
Thanks so much, Tracy. So on behalf of BU, it's really a great pleasure to welcome the UN Undersecretary and all of you to such an important and timely discussion that we're going to have today. Never before has there been greater need to determine how to infuse much-needed trust in our public health system and to combat misinformation. And I love this slide. I think that's really says it all right there. So addressing challenges as complex as global pandemics requires collective action and cooperation at every level. At BU, we've been asking the question of how we can adequately prepare for future pandemics through the 3 pillars of our institution, through research, education, and also service. At BU, we were fortunate to enter into COVID equipped with the National Emerging Infectious Disease Lab, which is a world-class biocontainment research facility that has BSL 2, 3, and 4 research capabilities. And the scientists and researchers at the Needle were a critical part of the U.S. response to the COVID-19 pandemic. However, the pandemic really made it abundantly clear that basic science alone is not going to prepare us for future pandemics. As a result, BU has made other strategic investments to ensure that we're not just advancing our work in the basic sciences, but also growing our capabilities in new directions. So a major example of that was the launch of CEID in 2021 with Professor Nahid Badilia as its founding director. And as Tracy alluded to, the center's primary purpose is to marry technical expertise in emerging infectious diseases with policy research and to provide recommendations for governments, communities, and academic institutions to help them prepare for pandemics at local, national, and global levels. As director, Naheed really marries on-the-ground clinical experience in West and East Africa during multiple Ebola outbreaks with extensive policy experience, having served as a senior policy advisor for global COVID-19 response in the Biden administration, and also as the interim testing coordinator for the White House monkeypox response team. And the discussion that we're going to have today, I think, is a really great example of the convening that CEID is engaged in and the ways in which we're trying to bring together different members of the community. So at BU, we're really committed to carrying the lessons of the last 4 years forward to ensure that we're prepared for the next global health crisis. The COVID pandemic really emphasized the need for collaborative research efforts, and we're really fortunate to work at a university and also in a region that's defined by innovation and collaboration. I think mostly at BU across many different disciplines, but also in Boston across different academic institutions, and also a lot of collaboration with industry and government. So one area which CEID has been actively working in is on the advances that can come about by combining recent work in data science and AI and others to help better predict future pandemics. CEID, together with the Hariri Institute for Computing and Data Sciences, was awarded a $1 million planning grant from NSF to prepare for the submission of a major grant around efforts to use data science to inform the emergence of future pandemics and also appropriate responses. So I'm really delighted now to introduce Yanis Paskalidis, who's the director of the Hariri Institute. He's a professor, distinguished professor of engineering, and also has appointments in electrical and computer engineering, systems engineering, biomedical engineering, and he's also a founding faculty member in the Faculty of Computing and Data Sciences. So Yanis, thank you.
Thank you, and what a great event today, and thank you for joining us. So we are in the midst of an AI revolution, and obviously AI is impacting every scientific field, every business function, education, our daily lives, and perhaps the area where AI can have its largest impact on our well-being is healthcare and public health. So our guest today will talk about AI and public health and that interaction, focusing specifically on public health communication. So before I introduce our speaker, let me mention that here at BU and at the Hariri Institute, we have a large portfolio of work in that space, in the interactions between AI and health, leveraging AI expertise on this side of the campus and connecting with experts on the medical campus like Naheed Badilia. And the fact that we are co-sponsoring this event today is an example of the strengthening ties between the two sides of the campus. So let me now turn to introduce our distinguished speaker, Melissa Fleming. Melissa Fleming is the UN Under-Secretary General for Global Communications. She assumed this role in September 2019. From 2009 until August 2019, Ms. Fleming served at the UNHCR, the UN Refugee Agency, as head of global communications and spokesperson for the High Commissioner. At the UNHCR, she led global media outreach campaigns, social media engagement, and a multimedia news service to distribute and play stories designed to generate empathy and stir action for refugees. Ms. Fleming is a frequent interview guest on international media platforms, and her talks are featured on TED.com. She is the author of the book, A Hope More Powerful Than the Sea, and host of an award-winning podcast, Awake at Night. Ms. Fleming joined the UNHCR from the International Atomic Energy Agency, where she served for 8 years as spokesperson and head of the media and outreach. And prior to the IAEA, she headed the press and public information team at the Organization for Security and Cooperation in Europe. Before that, she was public affairs specialist at Radio Free Europe, Radio Liberty in Munich, having started her career as journalist, And from 2016 to 2017, she also served as senior advisor and spokesperson on the incoming United Nations Secretary General's transition team. Ms. Fleming holds a Master of Science in Journalism from the College of Communication here at BU, so welcome back on campus, and a Bachelor's of Arts in German Studies from Oberlin College. Please join me in welcoming our speaker today.
Thank you for that great introduction, and it really is great to be back here, and I'm not going to calculate the years. I was trying to do it in my head, but then I got disturbed. But it's also very relevant because so much has happened between the time I graduated and entered into journalism and the communications profession. So I'd like to maybe reflect on that a little bit. But my job at the United Nations is to communicate about the state of our world and also to advocate for a better one. And that is by promoting peaceful, sustainable, and humane societies, and also a healthier planet for our world. I have to say, though, that year by year, that job is growing harder and harder. As getting those messages heard in today's post-truth era becomes more and more complex. So communications today must navigate a rapidly evolving information ecosystem, one that is polluted and toxic, I might add. Ever since social media became a dominant information source for people, we have witnessed how misinformation, disinformation, and hate speech is polluting our information ecosystems. And disinformation actors having mass distribution tools to circulate disruptive narratives. I mean, these are the same who might have been screaming in a park before with an audience of 3, now have the ability to reach thousands, if not millions of people. And also to attack people using AI-fueled tools. So we're going to talk about AI today, but also just to acknowledge that it's been with us for a long time on social media platforms, including the AI-fueled algorithms that are designed to prioritize user engagement, to amplify posts that generate outrage. And all too often, those posts that generate outrage contain hate speech and other disarming content, including conspiracy theories. And by design, these algorithms also limit the reach of factual and reliable information, including that from the United Nations. So, for example, on Facebook, the United Nations content is deprioritized. That is, our starting point is much lower than that of an individual. So this harmful online environment polarizes society and undermines trust, and we would argue ultimately, as I have here, it threatens human progress. And we're here today to talk about this. So yeah, I think you were promising that I was going to talk about all the promise of AI in public health communications. There is promise, and there's lots of promise in AI and health. But I'm here a little bit to talk about the dark side, because we're really concerned that generative AI tools are going to make things dramatically worse. I would like to echo, we are at the UN looking at the promise of AI, and particularly, as you said, in the healthcare area, in parts of the world, healthcare could become much more accessible. Diagnoses and efficiency could be better, more personalized support, and even it could facilitate access to information, education, free expression. But the rapid rise really in the information integrity community, and there is a huge information integrity community out there made up of people like me, people like many of the faculty researchers you see here in this room, fact checkers. Real alarm bells are going off because we're seeing new tools capable of supercharging information harms in multiple fields, affecting the health of our societies and including in the realm of public health. So while those of us who do communications for a living have had to get much more strategic in how we communicate, also more effective, we are in a race with disinformation actors. Depending on the topic, sometimes they're much better funded than we are, and who are seizing much more sophisticated tools. And one of our biggest worries is deep fakes, and the ease with which new technologies have made them easier and cheaper to create. Deep fake content can now be produced at scale and be far more easily personalized and targeted, and I'll provide some examples soon. They can also be distributed en masse via autonomous AI-run accounts, and this would have the power to further blur the lines between reality and fiction online, so that people already who are kind of not trusting very much are not going to trust even factual information and sources. So the problem also is that Gen I tools leave very few fingerprints. Now we have the capability to kind of figure out if there is a fake photo or a video. But it's going to be much harder for journalists, fact checkers, law enforcement, and just ordinary people to detect whether the content is real or AI generated. And even experts already now are struggling to tell the difference, leaving many people not knowing what to believe. And we've even seen some politicians who've been accused of certain things saying, well, that's not true, that's AI. So this is all happening, unfortunately, against a backdrop of decline in public trust in news and information sources. And it's, this is not true everywhere in the world, but it is very pronounced here in the US, as you see from some of these slides. And we're also seeing disinformation used in a concerted way to undermine institutions and also science. And deliberate campaigns calculated to use this distrust to deliberately inflame societal tensions, divisions, and to deepen a sense of chaos. This has created a feedback loop in which the loss of our trust also produces fertile ground for more mis and disinformation to spread, which then further erodes trust. So it's into this maelstrom that I'm tasked, and my team, and many of you who are going into the communications profession or public health profession or science, that we must communicate better for the world that we are trying to make better. And our work, obviously, is not easy. It requires explaining complex science around issues that have become polarizing to many. And science is also not black and white, as disinformation actors have the liberty when they create their content to make people believe. So whether it is the need for public health measures during the pandemic or the science behind climate change. So malicious actors are very quick to weaponize newsworthy talking points. They jump on flashpoints to achieve greater influence, and many even monetizing some of this content. We saw this in a very pronounced way, and I know many of you are experts here on public health and vaccines, where we saw emotive and false content being created around the vaccine rollout. But we're also seeing it around the wars in Ukraine, in Gaza, also extreme weather events or the cost of living crisis. We've even seen in recent weeks conspiracy theorists blame the COVID-19 vaccines for everything from the Baltimore Bridge collapse to actually cases of cancer in the British royal family. So this challenging environment is really making it all the harder, as I said, to communicate science. And I'd like to just focus on 3 of those areas today. One is the health of our bodies. The second is the health of our planet. And the third is the health of women and girls. And I'll start with the health of our bodies. As we saw, and as I mentioned, in the early days of COVID-19, we saw wild conspiracy theories and false claims circulating online. It started with the public health measures, and then very quickly about the vaccines, even before they were developed. At the UN, we knew that we had to push back, and I have to say, I work for the UN Secretariat, and we usually don't do public health communications. That is relegated to the World Health Organization, and to a certain extent, UNICEF, which rolls out vaccines. But we knew that this pandemic was going to touch on every dimension of society and our lives. And at the UN, this was a communications crisis, unlike anything that we'd ever done before. So we quickly joined forces and tried to become public health communicators, and saw, though, that something very alarming happened that completely transformed the conversation about vaccines. During the rollout, the total volume of information circulating exploded online. Good information and bad information. And with it, of course, the volume of misinformation, fears, conspiracies increased exponentially. However, and I don't want to review all of that, as we got out of the pandemic and the emergency receded, well, we and my team, we stopped communicating about vaccines. It went back to WHO, it went back to UNICEF, and they were busy, doing other things too. I mean, we have terrible wars, we have all kinds of other priorities. Unfortunately, as the volume of content coming from institutions around vaccines, and I would argue probably our national health communicators as well, the volume of the misinformation did not decline with it, as you see from this chart. Everyone that was speaking, positively moved on, but the anti-vaxxers did not. And we still have politicians and influencers and even celebrities contributing to the spread of unfounded conspiracy theories around COVID-19 vaccines, including, and let me list some of them, and these are not just during the pandemic, they're now, that they have caused mass deaths, that they contain strains of HIV, that they cause cancer or Alzheimer's. Others attribute, deaths. You've seen this, celebrity deaths or other deaths that occur that they attribute to died suddenly. So if you die suddenly, it was obviously the vaccine. They also claim that the pandemic was planned or orchestrated as part of a globalist plot and a conspiracy theory known as the Great Reset. The World Health Organization is frequently painted as a global force for evil, too, with detractors saying it's using its global vaccination program to harm people. And unfortunately, new tools powered by generative AI are making this content ever easier to produce. And, until recently, it did require significant investment. Manpower, influencer networks, these were all expensive, but generative AI tools have lifted these costs and also these manpower barriers. And so, large volumes of convincing disinformation can be created at scale. Now, AI developers do say, and I'll show you this recent study, that they have built-in safeguards to stop their tools creating content that is illegal or harmful. Yet researchers have been repeatedly showing that it's very easy to circumnavigate whatever defenses they say they have. And this is a study by Australian researchers that showed how quickly and easy they could bypass safeguards to create anti-vaccine disinformation at the click of a button. They did so without any specialized knowledge, simply searching online for prompts that would circumvent them. And it took about 1 hour to make more than 100 anti-vaccine posts in multiple languages. Fake but realistic-looking images and videos of vaccines harming young children, made-up patient and doctor testimonials, text with scientific-looking referencing, and these were targeted to speak to different groups as well. So very targeted, some to young adults, some to pregnant women, and those with chronic health conditions. So obviously, nothing new, vaccine disinformation, but since the pandemic, we're seeing it spread at new scale and speed. And the sheer volume is intimidating. And what we're also finding, I mean, I'm going to come to this slide in a minute, but we're finding, because it's become so polarized, that influencers who have been willing before to speak out about how important vaccines are now no longer willing to support. Our celebrity influencers, our political champions, and they're self-censoring for fear of attack. And so it's much harder. So just to say, right now, if anyone goes online to search for a vaccine, there is a 78% chance that they're going to get or disinformation. And this is having real-world impacts, as you can see in this slide. Our hard-won progress in vaccinating the world against childhood and other diseases is backsliding. A growing number of people, according to our data, UNICEF's and WHO's, are hesitant towards all vaccines, and numbers of people refusing to be vaccinated are rising. And in this study, you'll see the importance of vaccines for children declined during the pandemic in 52 out of 55 countries. And so what we found when speaking to a lot of them is that many of these conspiracy theories, or the reasons for their hesitancy, were from conspiracies that were seeded somewhere here in Tennessee, but because of the reach of social media, found their ways into villages in Africa, and mothers who once would welcome the UNICEF delegation coming to vaccinate the children are all of a sudden saying, wait, is there a chip in that vaccine that's going to track me? So WHO is saying that we're seeing the largest sustained decline in childhood vaccinations in 30 years. And we're also now seeing outbreaks of fully controlled diseases. You probably saw the news around Florida, around measles, but it's also polio, diphtheria, from Malawi to here in the US to Australia and France. Speaking to my colleagues at WHO and UNICEF, they're really alarmed by this. It's has, obviously also potential efforts to curb our next pandemic, so we need you all to find AI solutions for vaccine confidence. I do believe there is work going on around that. We obviously can't keep our foot off the pedal, especially when we look at that slide about how much mis and disinformation are dominating, because we're just not in that space with quality information about vaccines. Obviously there's so much more that we can do, urging the platforms that are spreading it to live up to their own principles. But I just like to point to a little bit to the methodology that we used that was quite effective during COVID. We wish we had the funding to continue it because, like all of us, we thought the pandemic's over, let's move on. But you see the aftermath. So we created a campaign called Verified, which was informed by disinformation and conspiracy narratives, but it was also informed by the lack of reliable information in digital channels, data gaps where people were searching and there was nothing there, or maybe there was bad information there. So we sought to produce cool content, very un-UN looking, at scale, very engaging, and in multiple languages, and also content that we could easily distribute around the world to our UN offices, to all kinds of media partners and influencers who said, yes, sign me up. We had a volunteer program called Information Volunteers, Verified Information Volunteers. Do you want to sign up and be a digital first responder? Even if you have 50 friends online, that's important to us. And we would send them newsletters and give them access to this content. You can adapt it, you can put it in your language, you can put your content. We also did a parallel media literacy campaign called Pause, Take Care Before You Share, to try to educate people that their own actions in spreading the information are also not realizing what they were reading may be false, is contributing to bad information spreading. And this is something that we have ongoing to this day. And we reached, over 1 billion people with this, what we would call mass communication campaign, but very targeted and very localized. And we've developed a very powerful network of trusted messengers. We also, again, informed by mis and disinformation, but also by academia who tell us that people are not reached by a big institution in New York City telling you that the vaccine is safe. They're reached by, a trusted messenger in their local community. So I just wanted to show you that we are doing something about it, but we're taking these hard-won lessons to communicating on other themes because, again, as I mentioned, we are in an information war on all kinds of fronts, and I'm not going into the actual war spaces where disinformation is creating a fog of war, unlike probably any that we have seen in our times, but I'm going to focus today on health and now on the health of our planet. So, this has been going on for a while. We have, I think the world is finally waking up to climate change. There's many scientists who've been working on this for 30 years will say, well, we knew, we predicted, it's all there, it was coming. But what we're seeing is how our social media platforms and our information ecosystem is conveniently being used as a tool for vested interests, fossil fuel, that is trying to continue the fossil fuel economy, but also platforms that are not doing their part in allowing, this was, I believe, before or just after Elon Musk took over Twitter, X, or whatever, but it hadn't fired yet all the trust and safety team, and so you can imagine what it is now. All the climate deniers are back, and it's a space for all kinds of climate disinformation. So we see a connection, too, that people in the anti-vaccine space are kind of shifting to the climate denial sphere. Anything that can create outrage and polarize is good. Some people are even making money off of it. There's one group that studies this phenomenon that calls them merchants of outrage. And these are people who are masters of the algorithm and don't care anything about truth, content that allows people to click and allows them to reap in the dollars. It's become climate, unfortunately, a new front line in the culture wars, and we're seeing it also having a lot of consequences that are really disturbing. How inspiring are the young people, like many of you? I'm sure many of you are climate activists yourselves. How inspiring are these young people? Amazing. How many of them that we're in contact are telling us that they're being attacked relentlessly online, and many of them fear for their lives offline. We are seeing, really a deliberate undermining of science, and We're seeing fossil fuel companies using greenwashing to trick the public into thinking their business practices are less harmful than they are. And unfortunately, this is leaving, again, the voices of action, the voices of change, the voices of healthy planet, struggling to make themselves heard. And we're worried about a recent report by the think tank Climate Action Against Disinformation, suggesting that AI is poised to supercharge climate disinformation in the same way as we've seen in the vaccine space. It's making it easier and cheaper to create content that questions established science, and it arouses suspicion, again, of public institutions. So as with the vaccines, it's also having real-world impacts. It's increasing the numbers of people who believe they can't make a difference on climate. So it's actually causing people not to act. Or that geoengineering is the only way forward, or that maybe it's just too late. The planet is doomed. So as more governments embrace the transition to renewable energy, we're trying to do something about this too. We believe, again, we cannot cede the floor to disinformation actors, and we are repurposing our communications. We're, again, trying to get out there, calling time on climate disinformation, and repurposing our verified model. This is just a preview of a coming attraction of how we might be using a disinformation narrative around, for example, solar panels, that they can't attract the sun's energy when it's raining. And instead of put like an X over it that this is a false narrative, we're trying to find clever ways and positive and forward and solutions-focused approaches to getting content out there on the benefits of renewable energy while subtly addressing the disinformation that is so pervasive. So injecting climate solutions and fact-based arguments, and really giving people the sense that there is a future. We'll paint a picture of the future, how to get there, and that the future is going to say, thank you. We have studies that people they need to feel some agency and hope here, and we hope that with this campaign, we're able to do this. So, since our focus here is on public health, I'd like to explore one more example that we're really concerned about, and that is the impact on the well-being of women and girls. We have seen for a long time gendered disinformation targeting targeting women and gender-diverse voices, gaining traction online, and coming in several forms to silence women and girls, to intimidate them, or even to shut them down. Authoritarians and other actors weaponizing online misogyny to intimidate critics. We see, and we've talked to many women who read the studies, that they get death threats, they get rape threats, they get humiliating doctored photos being sent to female journalists or leaders, activists, politicians, and celebrities. In 2022, UNESCO did a survey of journalists, women journalists, around the world, and 73% said that they had experienced online violence, 73%. And 20% that they had said that they had been attacked offline too and felt that there was a link. So those targeted, as we know, it's the vulnerable groups on social media, not just women and girls, but also due to their race and religion, all get the most vicious attacks. But especially those who are standing up for women's rights are targeted. And generative AI tools have handed these bad actors a new arsenal of weapons, with deepfake technology being used to generate non-consensual pornographic images. to shame and humiliate women and girls in all walks of life, with a grave impact on human rights. And we're even seeing these tools used against. This is a slide on the state of deep fakes. A couple of examples on how we're seeing this increase, markedly, and how quickly it takes to create them. And last fall in Spain and the United States, we had another alarm bell when stories about parents raising the alarm over AI-generated fake nude images of their teen daughters circulating online and through messaging apps, created shock waves, not just through their communities, but I would say all around the world, because what they showed was that the creation of these deep fakes was literally child's play. And it was their own fellow teen classmates who simply just added the pictures of the girls into an AI app. And what emerged was an authentic-looking pornographic deep fake. And it's part of a wider pattern, because multiple studies show that synthetic abuse material and deepfake pornography is now fueling a large industry of online monetized content. And just a second on, it's not just girls, but it's children. Child sexual abuse material. We're seeing the use of AI to create fictitious, photorealistic images and abuse of children for profit. And also mixing AI-generated sexual abuse images with the faces of real children. Just one study, researchers in the UK found more than 20,000, and this is just in the UK, AI-generated sexual abuse images posted to one dark web forum in just 1 month. So another study found that 1 in 3 deepfake tools can be used to create pornography. So this process is free, takes 25 minutes, and all that is needed is just one clear face image. So once again, as we saw when social media came onto the scene, we're seeing this again with the advent of generative AI, that so-called built-in safeguards are either non-existent in their design or they're falling woefully short. And this is just some of the reasons why government, civil society, and individual users are sounding the alarm and urging, and probably much earlier than took us a long time to figure it out with social media, and we're still not in a place where it's being properly addressed. But there is more focus. There is more legislation being introduced. And so we are hoping that instead of stepping up to address these online harms, those platforms that have lowered their guardrails will finally realize that this is causing so much societal harm that they need to do something. So the UN isn't sitting idly by, and others too. I thought this was incredible. The World Economic Forum at this year's meeting identified, they always have this kind of lists of the world's biggest threats ahead of their meeting, and they identified AI-generated mis and disinformation as the world's greatest threat, followed by climate change, saying that large-scale AI models have already enabled an explosion of falsified information. So we really need to address this. The Secretary General of the UN is made it crystal clear we can't go on like this. These threats to information integrity are a global challenge, and they require a global response to build resilience against them. And the UN is putting together we have an AI advisory board of the Secretary General that's calling for a closer alignment with international norms with how AI is developed and rolled out. And also member states of the UN are pushing for action. And last month, there was a General Assembly resolution, a landmark resolution, I will say, calling for the promotion of a safe, secure, and trustworthy AI systems. And really that they will respect, protect, and promote human rights. And that's really the core of it. And And at the same time, just to say that my department has been tasked with developing a code of conduct on information integrity, a UN code of conduct. And this code, which is going to be released in June, represents a push for coordinated international action to make the digital space overall more safe, more inclusive, and while vigorously protecting human rights, holding digital platforms to account, and encouraging them to live up to their own standards so that they stop rewarding and incentivizing harmful content and to push back against the proliferation of disinformation and hate. So just finally, we really are, here also, and I'm really glad to be able to address you because you're all looking for solutions in your studies to how we can, join forces to make the world better. And I'd just like to, leave that there are, many ways where AI can be deployed to actually be part of the solution. So maybe we could challenge you to work on that because AI certainly isn't going away. And we are also, trying to build a broad coalition of those, seeking solutions. So we are, I just wanted to flag this campaign, which is a WHO, United Nations, Gavi, UNICEF campaign that is going to soon be called Humanly Possible, encouraging people to share why they're vaccinated, why it's important to safeguard others, but also to celebrate vaccines as one of humanity's greatest achievements. Up there with landing on the moon, closing the hole in the ozone layer, or agreeing to a nuclear test ban treaty. More people need to speak out. And we have, this will be on the 24th of April, and WHO will release for the first time an estimate of how many lives have been saved by vaccines in the past 50 years, as well as the dramatic decline in child mortality. And that's going to be an astonishing, hopeful number. So we're going to focus more on the exciting and inspiring stories of human success as an antidote to all of this gloom and doom, and I hope you'll join forces with us to spread the word, and we can become the masters of the algorithm. There are more of us than them, and thank you. Let's reclaim the conversation together.
Thank you very much, Melissa. We'd like to open the floor to questions. There are mics circulating. For those who have a question, just raise your hand right up here.
Hi, Ms. Fleming. I know you've been saying that your organization has been renovating the design of some public health campaigns, trying to make it more targeted to younger generation. But I wonder, for those people who are in their 30s and 40s, they have parents to take care about and they have children to raise. Do you think that those kind of cutting-edge campaign will be persuasive for them? Would they treat them seriously, and how would they use this material to maybe educate their children or use it to take care of their parents? Yeah. Since I've been looking at fitness apps, and I found that usually those trendy design is perceived as less powerful than those carefully crafted and written articles and papers. And what do you think about that?
This is where things get tough, because to do strategic communications well, you really need to understand who you need to reach. Who is your target audience? Who is it that's resisting the most, whether it's vaccines or whether it's, and not those who are, the anti-vaccine community or the climate deniers. We need to reach people in the middle, the persuadable middle, and those who are perhaps vulnerable to disinformation, but also vulnerable, open to good information. I would say that's where we're working, and And the age group, it also depends on what we analyze as, who is that target, and also to figure out where they receive their information. During COVID, a lot of some of the most susceptible groups were older people on Facebook to vaccine conspiracies and disinformation. So again, but always it's really important what you said, because it's really, if you're going to develop a program, effective communications program, you really need to do that analysis of your population, and that is, where do people get their information and what influences them? What kind of content influences them, and what kind of people maybe who they would trust the most to deliver that message. So all I can say is it depends.
You might have seen the CDC said that the parental exemptions are at its highest in the United States as of 2023 for childhood vaccinations. And some of this is driven by policymakers at state levels. About 80 laws were passed, over the course of the pandemic, or proposed to roll back some of those public health, requirements. How do we approach policymakers that are potentially changing the landscape of public health regulations at the state level that have helped keep our childhood vaccinations up?
I would say probably those, again, it's back to that, do you target your communications at the actor that is the true believer in whatever you're trying to dispel? Probably not. But to the population around that person who, could be persuaded actually there is another way. So yeah, I mean, it is very worrying to see at the policy level that some of these changes are being made. So I would say work with the, communicating inside the populations on how critical it is for the health of your child, for the sake of your community, to have those essential vaccinations.
I think we have time for one more question.
Thank you so much for your informative talk. As a doctoral student currently in health services and policy research here at BUSPH, with a former and current focus on vaccine hesitancy, especially in immigrant and refugee communities, I'm curious, from your perspective, what role can academic researchers as well as policymakers play in supporting the UN's efforts to combat vaccine disinformation as well as misinformation?
Well, thank you for asking that question. We were just having that discussion earlier, because we at the UN often feel like we're under-resourced in that area of research. We have strong communication teams, but sometimes we might be just making assumptions. So we're talking about ways where we can maybe collaborate better with the resources you have here at Boston University, the incredible research, to inform our communications, including about disinformation trends, but also about what works. I mean, we're talking about, does inoculation and the information sphere help prevent people from going down these rabbit holes of believing things that are bad for them? And so, what are researchers who really have the expertise and the time finding, and how can we turn that and make it actionable? So I'm personally really inspired by the potential to work together.
Thank you so much.
Thank
Melissa.
you.
At this time, I'd like to welcome back Yanis Paskalidis for his closing remarks.
So thank you so much, Melissa, for such a thought-provoking talk, and thank you everyone for attending. So lunch is outside, so please stay for a networking lunch and introduce one to one another. Thank you for joining us.